Good morning, students. How are you all? Hope you are all fine and safe at home. Today we are going to discuss something new, and this is quite different from the usual subject classes. And we are going to discuss about health education in today's class. Do you know what is health education? Yes, education about health, right? We all require good health. We should maintain our health very well, isn't it? For that, we should eat healthy food. We should do exercise. We should avoid the habits like smoking and alcohol consumption, etc. Right? So, we all require good health for a good mind. For that, we have to do certain things, right? So, today, we are going to discuss about one topic related to our health education. And before mentioning the topic, I will show you a video. Watch the video carefully and try to identify our topic. This video is about circulatory system. Do you know what is circulatory system? Yes, we have already studied it in the biology class, right? So, you are all familiar with circulatory system. Now, I will show you a video. Watch the video carefully and try to answer my question. So, watch the video.
Your heart is a pump. It's a muscular organ about the size of your fist and is located slightly left of center in your chest. Your heart is divided into the right and left side. The division protects oxygen-rich blood from mixing with oxygen-poor blood. Together, your heart and blood vessels comprise your cardiovascular system, which circulates blood and oxygen around your body. In fact, your heart pumps about 5 quarts of blood every minute, and it beats about 100,000 times in one day. That's about 35 million times in a year. Oxygen-poor blood, blue blood, returns to the heart after circulating through your body. The right side of the heart, composed of the right atrium and ventricle, collects and pumps the blood to the lungs through the pulmonary arteries. The lungs refresh the blood with a new supply of oxygen, making it turn red. Oxygen-rich blood, red blood, then enters the left side of the heart, composed of the left atrium and ventricle, and is pumped through the aorta to the body to supply tissues with oxygen. 4 valves within your heart keep your blood moving the right way. The tricuspid, mitral, pulmonary, and aortic valves work like gates on a fence. They open only one way and only when pushed on. Each valve opens and closes once per heartbeat, or about once every second. A beating heart contracts and relaxes. Contraction is called systole, and relaxing is called diastole. During systole, your ventricles contract, forcing blood into the vessels going to your lungs and body, much like ketchup being forced out of a squeeze bottle. The right ventricle contracts a little bit before the left ventricle does. Your ventricles then relax during diastole and are filled with blood coming from the upper chambers, the left and right atria. Then the cycle starts over again. Your heart is nourished by blood too. Blood vessels called coronary arteries extend over the surface of your heart and branch into smaller capillaries. Here you can see just the network of blood vessels that feed your heart with oxygen-rich blood. Your heart also has electrical wiring, which keeps it beating. Electrical impulses begin high in the right atrium and travel through specialized pathways to the ventricles, delivering the signal to pump. The conduction system keeps your heart beating in a coordinated and normal rhythm, which in turn keeps blood circulating. The continuous exchange of oxygen-rich blood with oxygen-poor blood is what keeps you alive.
Have you watched the video? Now tell me why we need to take care of our health. Why we need to take care of our health? Okay, another question. Are you familiar with the term cardiac diseases? Cardiac diseases. The cardiology, cardiac surgeon. These are all related with which organ? Yes, our heart. So today we are going to discuss about our healthy heart. Do you all have healthy heart? Very good. So, we are going to discuss about our healthy heart today. The various conditions which affect our healthy heart and what all ways we can adopt to maintain our heart a healthy one, right? So, we can discuss about all these topics in today's class. So, one of our important organ is heart, right? If heart stops, can we live? If heart stops? No, right? So, it's a major and important organ in our body. Now, let me ask you one question. Are you familiar with the term heart attack? Are you familiar with the term heart attack? Yes, it's a condition which affects our heart, isn't it? Now, can you list some conditions which affect our health of heart or heart health? List out the various conditions or diseases which affect our heart. Come on, list out. Yes, the various conditions which affect our heart is, yes, heart attack, very good. Cardiac arrest, good. Heart failure, okay. Coronary heart disease, okay. Yes, high blood pressure. So these are the main conditions which affect our cardiac health. Now I will show you a picture which depicts the various conditions which affect our cardiac health and the signs and symptoms of those conditions. So we can discuss those diseases. Okay.
What causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity, and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite, where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures reestablish circulation to the cardiac muscle, restoring heart function.
The various heart diseases are heart valve disease, heart failure, coronary heart disease, arrhythmia, and also cardiac arrest and heart attack. We are all familiar with all these types of heart diseases, isn't it? So we have discussed about various heart diseases, right? So there will be some reasons or causes behind all these heart diseases. There will be some reasons, right? How heart attack is caused? How cardiac arrest is caused? Yes, there are certain causes behind all these conditions, right? And we have to aware of the signs and symptoms of those diseases. So, shall we discuss about those conditions? Okay. So, the causes of different heart diseases. First one, heart valve disease. When one or more of your heart valves do not work correctly, may lead to stenosis, regurgitation or atresia. Second one, heart failure. Chronic progressive condition where the heart cannot pump enough blood for your body may involve left, right or both sides of the heart. Next, coronary heart disease. Plaque buildup in the heart's arteries limiting blood flow. And last one, arrhythmia, a typically harmless, irregular heartbeat. So these all are the causes of different heart diseases. And their signs and symptoms are also provided here. So we have discussed about various conditions which affect our cardiac health, its causes, signs and symptoms. So now you are well aware of all the heart diseases, its causes, signs and symptoms, isn't it? Now tell me, how can we prevent all these heart diseases? How can we prevent all these heart diseases? In the beginning of the class, I have mentioned some points, right? You know, what measures we have to take in order to prevent all these heart diseases? Yes, maintain a healthy diet. Very good. Then, proper exercise. Then, maintain our body weight. Okay, then, yes, stop using tobacco. Then, yes, take medicines prescribed by the doctor. We can adopt all these measures in order to prevent our heart from heart failure, cardiac arrest, heart attack, etc. Then we can maintain a good heart. Is the topic clear for you?
Number one thing that I love to do is prevent disease. And preventing cardiovascular disease is why I went into cardiology. Now, getting people to prevent disease on their own is not an easy thing because it takes hard work, even though most of it is free. And there really are four major things that I recommend to patients to prevent a heart attack. One is to eat better. Now, for a lot of people, they think they're eating pretty well and they get a salad and they put ranch on it and some eggs and a whole bunch of cheese. And basically what they've done is transform their salad into a cheeseburger. And that is not a helpful way. Really, it is a low-fat, whole food, plant-based, unprocessed diet. These days, it's actually very easy to do with readily available, inexpensive ingredients. Things like oats for breakfast and brown rice and beans and some vegetables for lunch with a beautiful salsa on top. That kind of a meal is an easy way to do it without a lot of trouble. So that's one. Two is exercise. 30 minutes of brisk activity a day that leads to breathlessness. And if you have orthopedic issues, swim. If that doesn't work, bike. Try a recumbent bike. Try an elliptical. If you have trouble with your legs, use an arm bike. Whatever you're able to do to get to breathlessness is the goal. Obviously, check with your doctor first. So that's two. The third thing is stress. So most people don't realize, but stress, especially in Western society, is incredibly high. People have all sorts of stressors from marriage to work to finances, everything. Spend 30 minutes a day, meditate, pray, be introspective, do yoga, whatever you have to do to let things go. Four and final, and this is an interesting one, most heart doctors never talk about love. But why does love associated with a heart? Because they really go hand in hand. And the data suggests that people who have supportive connections in life, a spouse, a family member, a dog even, they do better. They have less heart attacks. They survive heart attacks better. And believe it or not, there's an emerging field of science in medicine showing this exact thing. So to put it all together in a way that people can really remember, live like a poor crop farmer. Now that may seem strange, but it's pretty simple. Eat what you grow, be active your whole life, be one with the earth, be at peace, and connected to others. That's it. And if you can do that, that is the best way to prevent heart disease.
So today we have discussed about our healthy heart, the various conditions or various diseases which affect our cardiac health, its causes, its signs, symptoms, and the precautions or the measures that to be taken to prevent these heart diseases, isn't it? So maintain a good heart or healthy heart is the best thing that we can do for our body, right? The major and the important organ of our body is heart. So in order to maintain a good health or in order to have a good lifestyle, we have to maintain a good cardiac health, isn't it? For that, we have to do proper exercise, take a healthy diet, maintain your body weight, etc. And all these can help in maintaining a good health and a healthy heart. Is the topic clear for you? Is the idea clear for you? So, take care of your heart more than other organs, right? It is our duty to take care of our health. No one else will do for us, right? It's our duty to maintain our good health. Is the topic clear for you?
Tips to reduce your risk for heart disease. First one, maintain a healthy weight. Second one, make healthy food choices. Third one, stay active. Fourth one, stop smoking. And know your diabetes ABCs, which means talk to your healthcare team about how to manage your A1C, blood pressure and cholesterol. This will help you lower chances of having a heart attack, a stroke or other diabetes problems. So all these are the tips that can be used to reduce your risk for heart diseases.